An ABC News medical contributor and pediatrician at Stanford Children's Health, Dr. Alok Patel, is here with more on all of this. Philadelphia has dropped their indoor mask mandate just days after the rule went back into effect. But in LA, a new mandate goes into effect today, requiring masks on all public transit and inside airports again. So what do you make of this all?
It's so confusing, Diane. And I think that phrase of mask mandate whiplash just really nailed it, because people out there just don't know what to do. People are flying across the country and reporting to me and to several others are like there was different mask usage being done in certain airports versus in certain cities. And I think what the bottom line is that people out there unfortunately have to play this own choose your own adventure, assess your own individual risk game, which isn't ideal. But the important thing for everyone out there to remember is that one-way masking is just how masking used to be, and it still works. If you're wearing a well-fitted N95, which isn't possible for everyone, you're gonna get optimal protection. But even if you're wearing an N95 mask that hasn't been professionally fitted, you're wearing a KN95, you're wearing a surgical mask, you have multiple layers on, you're still gonna get good protection for yourself. But people need to keep that in mind.
Now, in the past week, the CDC says new infection rates have grown by almost 33% nationwide, but hospitalizations are up 1.3% and deaths have actually decreased 15.7%. So what do those numbers tell you, and how concerned do we really need to be right now?
I think those numbers tell us the reality that we are reopening. Well, we have reopened. I shouldn't even put that in a future tense, but we have reopened while we concurrently have the most transmissible variant, which hopefully, fortunately, is not translating into more virulent illness. But this is why the mask mandate for travel was set in place until May 3rd to really assess what these 2 weeks are going to look like and if that's going to turn into something. We cannot forget about long COVID. So there's multiple things we have to keep in mind as we're just apparently letting cases rip roar.
All right, Dr. Alok Patel, we appreciate it as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.